Good evening. Thank you for having me here tonight. So I'm going to talk a little about doors. So it's the expression, you just need someone to open the door, and then you can make it happen. So in my last job, I was in North Macedonia, which is in the Balkans. And while I was there, the National Institute of Public Health released some statistics about menstrual poverty and the fact that in the country, 90% of girls who lived in rural areas and 75% of girls who lived in urban areas were missing school when they had their periods, which is obviously a startling percentage and having a massive impact on the education of girls. So we decided, what could we do about this? We looked into it, we set up a small project, a very, very small amount of money, and we discovered essentially that the reason why girls weren't going to school was not just that they didn't have access to sanitary products, but that in some of the schools, the toilets didn't even have doors. So, put a small amount of money aside, went into with one regional government, went into some schools, fixed up the toilets, and provided some sanitary products. But the main thing we did was worked with journalists to publicise what we were doing and what the problem was. And as a result of that, three things happened. First of all, the World Bank came in with funding and renovated the toilets in all elementary schools in the country. The second thing was the government decided to put sanitary products into the high schools. And then the third thing was the government decided to lift all tax on sanitary products in the country. So tiny project, but we opened a door and we had a huge impact. Cut to a year later, it's 2020. Don't need to tell people in this room much about 2020. But one of the things from talking to people was another healthcare desert we were coming across was around access to gynecological care. And it was particularly bad, once again, in rural communities where people were locked in their homes, women were not able to get out of them, and in some cases what was behind those doors was really not very safe. So we worked with a health organisation and they retrofitted an ambulance and made it into a mobile gynecological clinic. And it went around the country and it got into places where sometimes women had probably really never seen this sort of healthcare, Roma communities. So great story, great success. Once again, we opened a door, we got people into a clinic. But the problem was, our sort of aha moment is this is quite short term. This isn't the sort of public health work that the people in this room are trying to do. And in part, the reason why it's so short term is because the doctors and nurses who are volunteering their time to do this don't know the stories of the women they're helping. They don't know the community. They aren't doing what you have all been talking about tonight. So what we've been thinking about even now going forward is what tools can we give to healthcare professionals? How can we help them open doors? And one of the things that we've been working on, and I know people are going to be slightly doubtful about what I say next, is we've been talking about what tools are currently available. What's one of the ones that gets lots of splashy time at the moment is AI, right? So the UK, we've been working with the US, we've set up a technology partnership to look at how we can use AI in healthcare, not to replace doctors and nurses, but to give them the tools, to give them the information, so when we do go into these communities, we already know the stories. We already have the information that we need to help people. And that's what we've been thinking about. That's my aha moment, is how do we open more doors? And it's why it was so exciting to be invited to this event tonight by Healthbeat and the Georgia Health Initiative and to see your stories and what doors we're opening together. So thank you very much for having me here.